It's Tuesday, Toothday, time for another talk. I did have a request to talk about crowns today. Thanks, Joelle. So I'm going to talk about crowns for you. I don't know if you've had your appointment yet or not, but I bet you'll let me know when you do and how it goes. So I'll try to be brief, but I like to talk about a lot of stuff, so forgive me. So I'll talk about the indications for crowns and why we do them, and then I can talk about the procedure a little, and then maybe different types of crowns. So what we're looking for, I always really like to fix a tooth if it needs to be fixed. I like to fix it with a filling because it's more cost effective, and generally people are more used to getting fillings. But sometimes when the fillings have been large in the past, or if you have a big cavity or something is broken, we need to do a crown. A lot of people know what they are, but I'm going to go through it a bit. So one thing that might catch my eye on an x-ray, if someone needs a crown, is something like this picture. So all the bright white stuff on here is big silver fillings. It doesn't matter that it's silver, it's just a big filling. And this is all metal right here. So that's telling me I better take a look at that tooth and see, what it looks like in the mouth. And oftentimes, this is not the exact same tooth. But problems that I see oftentimes is that Erica's done a nice job here of showing some different problems with this. So down along the gum line, this tooth has got some decay. Right in here, the filling is kind of breaking away from the tooth. And same thing down in here, the filling is just separating from the tooth. Over time, the teeth flex a little bit and fillings don't. And that can cause things to fracture and just leave room for bacteria to seep down inside there. Even in and of itself, this is a huge filling. When half the tooth is filling, it's really susceptible to breakage. So that's when we're going to talk about a crown. And the filling really depends on a tooth to hold it in. So it needs tooth along the sides, ideally. And you start stretching the limits of what a filling can do, and you start building it out here. So a crown concept is the opposite, meaning it goes on the tooth, kind of like a hat on your head. It covers up the whole thing so that the whole tooth is kind of one again. So let me go back. Sometimes I'm just going to show you another really common thing we see, really common indication for a crown. This is a piece of tooth right here that's broken off. And again, here's this big filling, and a corner of the tooth is broken off. I just can't fix that with the filling anymore. It's just not going to work. You can contrast that with this filling that's actually working pretty well. The tooth isn't cracked or anything, and that tooth looks okay. But this one would be a candidate for a crown. So it's kind of a good example to talk about what we would do to get that appointment accomplished. So a crown is 2 appointments because there's some lab work that goes along with it. The actual crown, and I have some ones here, isn't fabricated here in our office. It's sent out from some impressions that we make, and I'll talk about that. So when you come in for the first appointment, what I'm going to do is take out this old filling, and oftentimes there's some decay, there's some unhealthy stuff that we don't like that we take out of there. So I'm going to take out this old filling and kind of fill in the center again with a newer filling material that I know is going to be stable. Sometimes we have to do that, and that's called a crown buildup, and your dentist may talk about that. And that's kind of like the filling that goes in the middle to help hold the crown on. So we'll get that in there, and then things change from your average filling. So we need to change the shape of the tooth. We need to make the tooth actually smaller. There's a little schematic of it here. So this is a nice clean little picture. It's not always the same in the mouth. We have to do a lot of different things. But it shows this tooth kind of looks like a little cone in this picture, and it shows the crown slipping over the top. So you can kind of get the idea. So we have to make the tooth small enough so that there's some thickness for a crown material. And that's one thing that there's no way you know to ask about, that you're going to trust your dentist to choose the right type of material for your crown. There's so many different types of materials we can use for crowns. And it's really important that your dentist has a good relationship with the laboratory that they work with. We kind of reference the lab as this phantom place where everything goes. In reality, there's thousands of labs across the country and across the world that we choose to send things to, and it's really not something that you as a patient would, ask about. What's your dentist's relationship with their lab? It's a really good question to ask. it should be a good one. It should be a good working relationship because the lab is depending on the dentist to send them quality impressions like this so that they can fabricate a good crown. If we don't get, a good impression for our lab, you're not going to get a good crown. And that's the dentist's fault if they don't do that. So the most common material that I use right now for crowns is zirconia. It's a mineral and it's very hard. That's what this particular crown is made out of. So this is an example in my hand. There's the inside of it and the outside of it. So it just looks like a tooth. And it fits on. This is a stone model. So this patient right now has a temporary crown that was fabricated out of plastic during that first appointment. When we change the shape of the tooth, we make a plastic temporary for you to leave with. You wear that for a couple weeks, you come back and I put this final one in place with cement. And that's zirconia. There are other materials that you wouldn't even know what to ask about. This is an example of a form that we use to order crowns. All kinds of different materials here that I won't get into. But again, you just kind of, you're trusting your dentist to choose the right material. Go ahead and ask questions about that if you want to. I'm not going to get into it because I could talk way too much about it. So most common is zirconia. Another material is called Emax that we use. I also do use gold still. The gold is excellent. It's probably some of the longest lasting material that we have out there. It's just that some people don't like the look of the yellow gold, but we do still do them. I put one in just last week. So for that, I kind of got off topic a little bit there, but during that first appointment, we're going to take out the old filling, reshape the tooth, make it smaller, like I said. Then we're going to take this impression of it. This is the goop. So we use this in the mouth. There are also scanners, like a video camera, sort of 3D scanner that we can use instead of this. That's coming very soon. Stay tuned for that, and it'll eliminate the goopy stuff. So once we take the two impressions, top and bottom, so they can get the bite right, then we're going to make you a temporary crown and let you go. Meanwhile, while you're gone, we're going to ship out all this stuff. We're going to order your crown, have it back here on time. You can come back. The temporary one does come off relatively easily. We just take it off, fit the permanent one on, and use permanent cement to glue it on there. The cement isn't the only way that it's held on. Again, you're really relying on your dentist to shape your tooth right. The tooth needs to be shaped in such a way to help hold the crown on. Like when you stack 5-gallon pails together and they suction together, that's the same concept of how a crown really stays on. That's really what holds it on much more so than the cement. So if you're having a lot of trouble with crowns coming off, a lot of times it's not the cement. Sometimes it can be the way that the tooth was prepped. Sometimes it can be you're clenching or grinding your teeth. So that's one thing to look at as far as, technique. It's important the way that your dentist shapes your tooth. As far as crown materials, I just want to touch on one question that I get a lot. People are afraid they're going to get a crown that looks like this, and people ask me about this. What's this edge? And they're worried about this dark edge. And what this is an old crown made from metal inside. And when the person had this crown done, their gum line here was probably down here. So the gums receded a little. Now you're seeing the edge of that crown, and it looks kind of leaky. And this is in this patient's smile. So it shows, and it was a question posed. So the crowns I use now don't typically have the metal in there, so the edge wouldn't show. And again, I bet that crown has been there for many, many years, so the gums have pulled back and shown the edge of it. So that's a common question, and it's mainly related to the fact that this dark edge here is metal, and we don't do that anymore. And also just the gums pulling away with time. So this person's probably going to have their crown remade so that it looks nicer. And then longevity for crowns, really the most important part about that is how you take care of them at home. Because the reasons that they're lost, the most common reason I see that I need to redo a crown is if the gums pull away a bit and it'll decay. So if the gums pull away, you get some, gum disease or recession, and it exposes the root, and then you can get a cavity there, and that cavity is going to travel under that crown. And the only way for me to fix that is to redo the crown. So a lot of times this is a home care issue, keeping the area clean. It's usually been there at least 10 years, typically longer. Or sometimes when people get dry mouth, this can really be a problem too, if people have a problem with their saliva. So crowns are really designed to last a long, long time with the proper care and the proper material and a good dentist who's paying attention to all of these details. So that's pretty much what I have to say about crowns. So thanks for listening.